Currently, brain disorders are being classified using the diagnostic criteria, meaning that you have a series of symptoms or not, and based on those symptoms you're actually being classified of having, for example, schizophrenia or Alzheimer's disease or autism, for example. The origin of the PRISM project is really trying to understand the neurobiology underlying common symptoms seen across disorders. So for example, social withdrawal is seen not only in schizophrenia patients, but also in Alzheimer's disease patients. So what we try to do here is to understand the neurobiology underlying social withdrawal and to find out whether this biology is similar or different in certain patient clusters. The main aim of the PRISM project is to identify quantitative biological parameters that allow us to differentiate different patient clusters based on the biology, rather than on the initial diagnosis. And based on that knowledge, we hope then to make clusters of patients that allow us to understand the biology underlying these clusters, and therefore having a new insight into potential novel treatment strategies. Currently, we have treatments available for brain disorders that are not truly acting on the origin of the disease, but rather trying to reduce symptoms. So I think if we really want to treat the origin of the disease, we need to go much closer to the biology from which those symptoms originate. In order to have more this biological approach, we of course first need to find out what biology is wrong in these patients. To do that, we don't want to use all kinds of questionnaires with answers, but we would like to have more quantifiable measures that are much more closer to the biology than are the current clinical symptoms, symptomatologies. So we will use all kinds of biological techniques that allow us then to cluster patients based on the outcome of these biological measures, rather than on the initial diagnosis. PRISM will provide a proof of concept of this ID by studying both schizophrenia and Alzheimer's disease patients that are characterized by low and high social withdrawal. These patients, irrespective of their diagnosis, will be tested using a biological testing battery consisting of EEG measures, measures from the brain imaging, behavioral measures and some biological measures such as epigenetic markers. Using that and statistical analysis, we will then hopefully be able to provide novel clusters of patients that are based on these biological measures, irrespective of their initial diagnosis. In parallel, we will develop a homologous testing battery in animals that allow us then to back-translate the information coming from these clusters of patients into animals, to expand our knowledge on the neurobiological principles underlying these clusters. We are guided here by available cohort data with genetic data but also phenotypic data that then allow us to understand more maybe the biological substrates underlying these phenotypes. So in the first phase of PRISM, we hope to provide those quantitative biological parameters, allowing us to cluster these patient populations on the basis of biology. In parallel, we hope to have then also this preclinical testing battery available so that we immediately can back-translate the human findings back into the rodent models, allowing us to subsequently study the neurobiology.